The highest level athletes don't have to be 100% to perform at a really, really high level. That if they stick these 21-year-olds in a major league season, they're not going to make it. She shorted it, slipped, and landed on her head, and she was paralyzed. For women's football has one of the highest concussion rates, higher than the men's game. It's all based on symptoms.
Viva la cancha, where football is life.
We want to be the most played game in the United States. For me, this is the greatest sport in the world. Connect the world, religions, faith, beliefs.
The goal has to be there of social change, changing the community.
All right, welcome back, my friends. We are joined in this segment by someone who you will be amazed after we talk to him. His name is Dr. Jeffrey Dugas. He's a renowned orthopedic surgeon at Andrews Sports Medicine. And guess what? He's known for operating on elite athletes across MLS, NFL, MLB, WWE, UFC, NCAA, and guess what? Other top-tier sports organizations. I will just bring him into the show. Dr. Dugas, thank you for joining us.
Thanks, Santiago. Great to be with you guys today.
I know that you are in between perhaps surgeries, so we want to thank you for taking the time to join us. This is the first time that you are on a show like this, or you've been
I've other podcasts and webinars, but the first one with you guys. Thanks for having me.
All right. Well, thank you for joining us. Matt,
sure.
We've got someone here who can talk to us about some of the issues that we were discussing earlier. Junior,
Absolutely.
obviously, feel free also to chime in and talk to us. Well, first, Dr. Dugas, briefly, tell us a little bit about you, what you do. I do have your bio, but it's better that you just tell us what you have done in your career with athletes.
So, college and med school residency fellowship, I had a chance to train in Birmingham with Dr. Andrews, and the expectation, my wife and I were planning on going back to the Carolinas where we both grew up, and Dr. Andrews offered me a job here. And that was too good of an opportunity to turn down. So we thought we'd be in Alabama for 1 year, and that was 25 years ago. So I've been here ever since. And my partner, Lyle Kane, and I were fellows together, and we've been side by side for 25 years. We take care of all the, active people. Athletes are part of that. The highest level of athletes are a very small part of that because there just aren't that many of them. And thankfully, they don't get hurt at the same pace that the high school kids do. But, we take care of active people, and that's not limited to people that wear a number on their back. It's housewives and janitors and everyday people who get hurt but want their lives back. And so I always define sports medicine as I don't have time for this. If I got hurt today and I don't have time for that, I got to get back to my life, and I want to be treated in a way that gets me back. So, we work with all the high schools, and we take care of about 50 high schools. We take care of 9 NCAA colleges in Alabama and around. We have relationships with all the pro organizations, NFL, MLS, MLB. We're all consultants for multiple teams and leagues, and then I do the WWE and the Alabama Ballet and all these other things. So we work with kind of athletes at all levels, and it's a really interesting. My days are pretty interesting, so I love what I do, and I get to work with incredible people.
I'm glad that you said that. Let me when you said that sport medicine is seen as I don't have time for this.
Yeah. I usually put an expletive after that, but I don't have time for this stuff.
I'm one of those, Dr. Dugas. I have to confess to you. I was sharing with Matt and Junior during break that last week I went to a sport medicine doctor, and he gave me a few exercises because I have a muscle sprain. And the exercises seemed to me very easy, quote unquote, dumb exercises. And this is to prove this. I'm sure you have this, right?
Yeah.
Right. And then after a few exercises, I said, well, this is actually working after a week or two, but they look so simple. They seem so simple to do that you're like, really? Is he really telling me to do this? Is that the reaction that you have from some athletes sometimes when you tell them, you want to get better? Do this.
Most of the time with those kind of muscle tendon injuries, those things don't tend to get elevated to our level. They're usually taken care of through the athletic training staff or the physical therapists that work with teams and things like that. In our practice, we have 10 non-surgical sports medicine physicians that they treat all the non-surgical stuff. So, people with muscle strains, tendon strains, things like that, those are going to get peeled off before they get to me. But yes, they do tend to work well, and the muscle has an amazing ability to heal quickly, great blood supply, and those things are rarely surgical problems, and typically some therapy, whether it's stuff you do with a therapist or do at home or with your athletic trainer or conditioning people or whatever. Those are typically things that get better, and they take days to weeks, and you're past it.
Yeah, sometimes we fail to recognize that you and others professionals went to school for many, many years. So we should never judge like how dumb the exercise are. There's evidence behind that, right? Matt Marshall, who's here with us, he played college soccer. We call it football. It's not American football, but football. You're familiar with that, Dr. Dugas.
Got it. Oh, yeah.
And Matt had some questions for you based on his experience as well and other.
Sure. Definitely. And especially to your point of kind of the non-surgical, the injuries. I speak with a physical therapist often who really seem to have it in their mind, and even acupuncturists I can name who talk about the amazing things of the human body, right? And how it really can heal itself. But in sport, to your point, it's like, I don't have time for this stuff. Like, you need, especially at the highest levels, you need surgery to get back, I guess, to your best performance in the quickest way. Can you kind of speak to the importance of kind of a short-term injury or injury break and surgery and its long-term effects in recovery and what the differences are?
Obviously, when you're dealing with the highest level athletes, they play long seasons. They're not dealing with a 2-month season. They're dealing with a 6 to 8 month season, and the off season. So the amount of time that a professional is taking a break from training and performing, it's usually not, half the year. They're usually training and performing 10 months out of the year, and they may get a break, at the end of the season to rest. But in the preseason, the training is very compressed, and you're giving high effort every day to get ready for the season. So there are some seasonal variances in muscle tendon injuries. And then those are typically not surgical. We're arresting those, we're rehabbing those. And the other thing about the highest level athletes don't have to be 100% to perform at a really, really high level. They are good enough to get by with a percentage of that. Now, they're not going to get by with 50%, but 90% might be enough for them to be still better than the person that would replace them. And at the highest level, those are things that are considered by coaches and GMs and things like that. Does this person need to take a break from the team because they're below that level and they're not really contributing, and continuing to push them is not going to make that better? And we need a break for 2-3 weeks to recover, let that muscle, that tendon, whatever, get better through rehab and all the modalities and all the things that therapists and trainers can do. Versus, is this something that's surgical? Did they detach a tendon? Did they tear a ligament? Did they fracture a bone? Do they have a loose this or loose that? Those are things that aren't necessarily going to be better with time. And even with that, there are times where we can still brace it and play. We see that with shoulder injuries in American football and in football. If you have a shoulder injury, and unless you're the goalie, we may be able to brace you, rehab you, and keep you going through the season and deal with it at the end of the season, versus having to take you out. If you tear your ACL, you're not going to go back to high level football. It's just not going to happen. It's too much agility for you to really play with that. And all the players and the coaches all know that. But, short of that, there are certainly things people have and can play with and maybe not be 100%.
So there's Yeah, go ahead.
I just as a quick little follow up to be a little bit more specific to it, maybe an injury. Like I think of meniscus when I think of this, or there's other injuries, but there's certain things that you'll see professional athletes deal with, and it says they'll say, yeah, to your point, they're going to wait to have surgery until after the playoffs or something like that.
Right.
In your mind, are there any injuries that absolutely need surgery, or if you had all of the time in the world, could most injuries be corrected with this rehab and these non-surgical procedures?
No, there are definitely things that have to be fixed. You're not going to see a high agility athlete. The percentages are against them if they have joint instability, if they have a torn ACL, a pitcher with a torn UCL. Those things are, you detach a tendon, tear an Achilles. Those things you could try to play, but you're going to be a shadow of what you want to do. And are you doing more harm in the long run? These are people first and athletes second. And, what is their career? Is this their last chance to play? Are we dealing with a 36-year-old, left wing, attack person, and this is their last season and their last go at it, and they know they're retiring, and yeah, okay, maybe we're going to push that. It's the playoffs, it's the World Cup. Yeah, are we going to push those things? Yeah, it's their last go at it, and they know they're done with it. But if you're talking about a 21-year-old, that you could be limiting their career by pushing that with a torn ACL. They can do damage to other things that would be worse for them down the road and could cut off some longevity on their career. So I think the seasonality of it plays into those decisions, as well as the longevity of the career of these people, if it's their career, and what their lives could look like down the road. If you're dooming somebody to a bad knee or a bad elbow or bad shoulder or something like that, potentially by making these decisions, does the benefit outweigh the risk? And, we have to be objective in our roles, not fans. We have to be objective and make sure we cover all that ground with the athlete, that this is not only a short-term solution or a short-term thought process, but a long-term thought process. And we have to think through that and make sure they're aware of those things.
Yeah, Dr. Dugas, I guess that oftentimes you're faced with the following, right? Which is, how do you reconcile the emotional aspect of an athlete plus the medical advice that you will provide them, right? Because let's say a 21-year-old kid is really want to play, and maybe they come to you and tell you, hey, Dr. Dugas, is there any shortcut? Is there any specific shot that you can give me that it can take me? And then you're put into this dilemma. Should I just help this little kid? That actually, if I give him that, it may actually hurt it more than helping in the long term, right? How do you reconcile that?
And we face those questions all the time. And the first question I always ask them, does the benefit outweigh the risk? I can recall a time where we had a guy who was going to play in the Super Bowl. This is the Super Bowl. And he had a broken bone in his leg. And the question was, could we just numb it up so he could play for 4 hours? Could we numb it up? I mean, it's the Super Bowl. If you're ever going to do it, that's when you do it. You don't do it for the first season game. You don't do it for a preseason game. You don't do it for a high school kid. We're talking about a pro in the Super Bowl. So if you're ever going to do that, that would be the time to do it, right? And so that's what was done. It wasn't a player that we took care of, but one of my colleagues. And the decision was to numb it up and fix it, after the Super Bowl. And he did great. And he played, and it was fine. Was there some risk involved in that? Sure. But it was the Super Bowl. Right. So I think you always have to take into account the frame that you're looking at. What is the risk? What is the benefit? It's rare for an athlete at any level not to want to compete. But athletes typically are willing to hear the perspective of, is this next game, this part of the season, this part of your career, is this more important than potentially ruining the rest of the season, the next season, your career? Is it worth taking that risk for this event, whatever you're thinking about taking this risk for? Is it worth it for the potential risk of losing that? And if they say, look, I understand it, inject it, I want to try to play, they may not be able to do it. They may get hurt worse. But my role, I think, is to convince them that there is a risk. And if they want to take that risk, is it likely it's going to help? Is it okay for them to kind of ease into it? So let's just take an example. We got a guy with a torn ACL, and it's the second half of the season. And we know if we fix it, he's going to be out the rest of the season, but back by the beginning of the next season, probably, or somewhere in that time frame. And we're talking about somebody in their 20s, and they're a really good athlete, and they want to try to play. Okay, we inject it. Are we going to inject it every week? Are we just going to keep throwing cortisone in this guy's knee? Are we going to inject some kind of biologic with the misguided hope that it's going to heal all of a sudden? That doesn't really work. So it's not going to heal. Could we brace it, inject it, make it palatable, and get through the season? Yeah, we might be able to do that. But what is the risk? Well, the risk is that maybe now he's going to tear his meniscus or the other meniscus, or he's going to rub away some cartilage and start down the arthritic path. So if that happens, I can fix your ACL. That's easy. But meniscus doesn't heal as well. Cartilage doesn't heal well at all. And you've now put yourself in a position in your mid-20s where playing till you're 35 becomes hard to fathom, because you're on that path and they're going to replace you when you're not as good as the next guy. So does the second half of that season where you got hurt, is doing that worth the risk of what potential long-term loss you could have? Most of the athletes are going to think about it for a short period of time. They may even try it, and they're going to realize very quickly that that doesn't work very well, and they're better off getting fixed.
Matt, you were an athlete. What Dr. Dugas is saying, does it relate to your experience? Not that you obviously got injured and had to go through the process, but maybe your teammates. Is this something that takes place quite often in your time as an athlete?
Absolutely. From my perspective, I remember so many injuries, and as an athlete, you just know that it hurts. There's a threshold for pain that you can take. But you just want to get back as soon as possible, and you just want it to not hurt as much. And now a lot of my injuries, I still feel to this day, which is also interesting. It's just something that either I got surgery or had physical therapy for that helped me make it better. But the injury kind of never completely went away. But definitely something.
Yeah. And pain is something that most athletes can tolerate. They can perform. Like I said, most athletes, if you ask them any given day, are you 100%? They'll kind of look at you like, I don't even know what that feels like.
Right.
I wouldn't know what it felt like to be 100%. That's the nature of being an athlete. So they're used to pain, and they're used to not feeling quite right. There's a difference between that and they can't go and play their sport the way they play it. And they get to a point where even the next person on the bench can outperform them. And they're just a liability. They can't run as fast. They can't cut as hard. They can't jump as high. They can't throw as hard, whatever it is. And they know, like, okay, this is not okay. And I'm not okay with this. And those are typically the kind of injuries that you fix. The muscle tendon stuff, hamstring injuries are a good example. Hamstring injuries, quad muscle injuries are very common in football, and ankle sprains, very common. Okay, are they all surgical? Definitely not. Hamstring injuries are rarely surgical, but you still got to be fast enough to play, or somebody's going to blow past you in a hot second, and you're going to look like not good. Again, expletive. You're going to look pretty bad out there when somebody's running past you. And that was a bad decision at that point. And, so is it better to take a couple of weeks, let it heal, get it stretched out, get your speed back and come back? There are components to that have to do with how important are you on the field at this particular game? Are we talking playoff time, or do we rapid inject it, make it feel better, go get through your 3-hour match, and we'll deal with it later? Yeah, I mean, there's times where that makes sense, but then there's times where it definitely doesn't.
You know what, Dr. Dugas, there is such a level of competitiveness in any sport, but let's talk about soccer, right? That nowadays you have so many championships, so many leagues, so many games that you have little time to rest, let alone to take a week off to get better. And if you are a good soccer player, your coach does not want you to rest because everything depends on you. My question is, and again, two questions. What is the most common soccer injury that you have seen? I think you just mentioned a few. And second is, how do you, it seems to me that you become kind of like a psychologist with the player. And you have to really talk to him or her about, listen, take a week off. And then he or she has to go back to the coach, and the coach is like, no, dude, can we do something here? Perhaps that can only have you rest for 2 days and not a week, as Dr. Dugas suggested. I mean, I'm sure that you see this quite often.
We do, and obviously at the higher levels, the coaches understand it a little better. You get pushed by coaches a little harder at the lower levels. The coaches don't typically push us too hard at the higher levels because they know that the athletes would do anything to play. If they were capable, they would do it. These are professionals. These are people in the elitist level. They're conditioned to play with less than normal. When you hear a pro or an Olympian or somebody like that say they can't go, they really can't go. And we rarely see people kind of sandbagging that. That doesn't happen. And so it's not the coaches that are pushing. They obviously want to know what our options are. But that gets into, like you said, the psychology of this and the communication. Our role is to communicate all of the things. And the other thing I'll say is everybody looks at imaging and they hear hamstring strain. All hamstring strains are not the same. And how one athlete handles it and can get back from it may be different than the next athlete. Even if the imaging, the all-knowing, all-telling window into the soul, the MRI, says this. That's not, I'm being facetious. The MRI you got to be careful not to treat the image, especially an athlete. If you want a reason to overtreat an athlete, get an MRI. They don't look normal. Their bodies aren't normal. And if you're waiting for normal, you're never going to see it. So if you're managing the MRI, you're over managing the athlete. So the MRI doesn't have to look normal for you to play normal. And so you got to be really careful managing these things, especially in athletes. And, people hear, oh, I've got a grade 2 hamstring strain. Okay. There's treatment options for that. Inject it, don't inject it, rehab it, therapy it, all that. You're looking at weeks. It could be 1 week. It could be 3 or 4 weeks. Everybody's going to be different, and it depends on what the demand on that athlete is. Right? So it's and how much their tolerance is. And again, you're basing that on an image. The image is guiding. It's not all telling. And some of those grade 2s, are they kind of on the low end of grade 2? And maybe they're going to be a 1 week injury, and the other one's going to be kind of a high end grade 2, maybe tending towards grade 3, and it's going to be a 4 week injury. And what is that athlete's demand? How hard do they have to go? How many minutes are they going to play? What's the schedule look like? Where are we in the season? There's all these different factors that play into it. And the coaches and the athletic, I can't herald enough how important the athletic trainers and the PTs are to this process, because as the physicians, we're not with these people all day, every day. Right. The athletic trainers and the therapists, they know these athletes and they know their personalities, they know their bodies, and they're with them all the time. So their interaction with them is so important in terms of what we can know and not know, and how to manage them on a communication level So our relationship with the athletic trainers and the coaches is super important. And those are kind of the MVPs of all this. You know, we're helping to make decisions and giving them options in terms of treatment options and things, but ultimately it's that axis of communication through the medical staff of the team that really is helpful and makes it happen. I'm sure Matt would agree with that.
No, I totally agree. And especially the don't treat the image, that resonates so well, especially not only as an athlete, but as a fan. You know, we see the same ACL tear that one player had, this player recovered from it in 3 months, and that player recovered from it in 6 months to 9 months. And so as a fan, you're just kind of like, what is this? And to the point of ACLs, I remember growing up, ACL was a career-ending injury. So I'm curious if you can speak. And now, and I also don't remember hearing anything about Achilles injuries. Now, all I hear about are Achilles injuries. And I'm wondering, and I'm just putting all these things together in my own head. I'm like, to Santiago's point, the length of time that athletes are playing longer, the growth of sports medicine, which is also making them stronger and faster. Does that play a part? Now you said 25 years at the American Institute of Sports Medicine. What have you seen kind of transition over that time? And does the growth of the athlete play a part in some of these medical issues that we're seeing change over time?
Yeah, I think there's no question in every sport we're seeing bigger, stronger, faster.
Yeah.
It doesn't matter what sport it is. It's bigger, stronger, faster. And you're also seeing early sport specialization in youth. You're seeing people going down to one sport at very young ages. So it's all condensed and it's all one movement set. You know, baseball is probably among the worst of those because, you know, baseball being a rotational sport, you're always either throwing or turning in the same direction. And so you know, there's so much opportunity to play year-round participation, and you're playing one thing. So your body's doing the same things all year with no rest and no recovery time. And there's the injury rates that we're seeing in youth sports have not decreased. We may have been successful at decreasing the concussion rate in some sports or, you know, things like that. But just on the Tommy John injury front in baseball, we have not been successful. No matter what data we put out there, we have not been able to decrease the rate of those injuries. You know, soccer has become it's always been a little bit of a year-round sport, but we're seeing specialization. It's at very young ages where it's one sport all the time. And that's a pounding on your body that your body was not necessarily designed to take. And, you know, I think it's important for parents and coaches and everybody to remember some of these kids. These are developing people. The male body doesn't complete its development until it's in its early 20s, you know, 23-ish. That doesn't mean you're getting any taller, but your body just continues to grow and develop. It's not fully mature till your early to mid 20s. Females a little bit earlier. Males are 23, 24, females, you know, 22, 23. But we're asking the highest level of competition and the longest seasons. You know, I always make the point that in Major League Baseball, there's 162 games. But the average age of a Major League Baseball player is 28. The average age of a AAA baseball player is 26. The average age of a AA baseball player is 24. The average age of a single A baseball player is 22. And you play 162 games in Major League, 140 games in AAA, 120 games in AA, 100 games in single A, and colleges play 70 games, and high schools play 40 games. Why is that? Is it because there aren't enough ball fields to play on or the sun doesn't shine? No, it's because the pros know that if they stick these 21-year-olds in a major league season, they're not going to make it. Their bodies aren't ready for that level of workload. It's a workload question. And so I think you apply the same thoughts to all the sports. Football probably does the best job of that, American football, because it really is only a fall sport. They only compete from, you know, August to December. And the rest of the time they're conditioning and training, but they're not contact all that time. Most of the other sports, basketball, volleyball, soccer, baseball, softball. These are year-round, pounded all the time sports. So we see those kind of injuries, and we're training them bigger, stronger, faster, and we're seeing the result of that.
Viva la cancha, where football